welcome back to another Teach Me in 10. Today we're joined by Dr. Burnett, a urologic surgeon and professor at Johns Hopkins University, who will teach us all about sexual function, from what it reveals about our general health to practical tips for maintaining sexual health for our overall well-being. Let's get to it. Hi, thank you so much for joining us today. So to start us off, could you explain the role that sexual function plays in our overall health and wellness?
Absolutely. Well, sexual health is really a barometer, a gauge, if you will, a determinant of our general health. So much that goes into sexual health involves the basic biology of our bodies, relevant to the cardiovascular system, the nervous system, systems that have to do with other disease states and conditions. So if you're healthy with your sexual function, you're healthy in general, and vice versa.
So to get into the specifics, what type of conditions commonly first show up as sexual health problems?
Well, yes, we've recognized that there are some common health conditions, uh, and even some lifestyle health conditions, which we can talk about. But commonly, we see cardiovascular health issues, diabetes. Those probably represent the large chunk of what we see for patients. We use this term metabolic syndrome, which refers to kind of constellation of adverse cardiovascular health, obesity, adverse cholesterol levels, hypertension, and just adversity of the metabolic systems of the body. So these kind of profiles that we see more commonly with the way we live our lives these days, perhaps, all are common conditions.
So to look at the bigger picture, how do psychosocial and lifestyle factors affect sexual function?
Well, that's a, you ask about lifestyle and psychosocial. There are dimensions to all of these things. Lifestyle could refer to things like, how we go about maintaining a good level of fitness, our diet, whether we're exposed to environmental factors that are adverse, things that we're responsible for. Such as cigarette smoking. I'm a strong proponent of not doing cigarette smoking. But if you live in a toxic environment, if, with variety of pesticides or variety of occupational hazards, those things can be factors too. Now, psychosocial, kind of a slightly different consideration, refers to how that can be a factor in having sexual dysfunction or a consequence of that. And that has to do a lot with, understanding that how we approach our sexual lives does have kind of a mental health component to it. It may have to do with sometimes interpersonal relationships, uh, our general sense of well-being, depression and anxiety, and all these sort of things. That also can lead to sexual problems, but also can be a consequence of that as well.
So to wrap up with some advice, what practical steps would you suggest to help maintain our sexual health?
Well, practical steps, frankly, are be aware of how we live our lives, gauge our general long-term health, and that is part of that is sexual health. And so you've heard me comment on a few things. If you're not in the best of physical shape, try to get more fit, have a better diet, balanced diet, fruits and vegetables, not all this processed food many times, fast food places. If you're a cigarette smoker, discontinue that. That's not so good for your vascular system, your blood vessel system in the body. So all of these sort of things, I think, are initial steps. Next things are, follow through with your medical checkups. See your regular physician. Get a good health checkup. Sometimes there are things that you won't always just have symptoms for, and so you have to get a checkup and make sure you're maintaining your good general health with a doctor's checkup now, or at least some sort of clinician. There are nurse practitioners and others out there who are very capable care providers as well. So those sort of things I would say to start. Sometimes you do have to see a specialist like me, a urologic surgeon who specializes in sexual health, and we may have to bring some advanced interventions. But let's start with the most basic things that I've talked about.
Definitely, that's some really great advice. Thank you so much for your time today.
Oh, it's my delight to be with you, Georgie.
Thank you again to Dr. Burnett for joining us. To learn more, check out the links in the description, and don't forget to stay tuned for our next installment of Teach Me in 10. Bye for now.